name is Janeta. I'm going to be doing your head to toe assessment today. First, going to start by washing my hands, and then I'm going to do your general survey, which is your level of consciousness, your mood and affect, your stated age, your hygiene, your posture, and your nutritional status. So for your level of consciousness, I'm going to say that you're alert oriented times 4 because you can tell me where you are, which is
my house.
What day it is?
Friday, April 21st.
How old you are?
15.
And your name?
Madison 10.
Alright, and her mood and her affect appears to be calm. She appears happy. She's not looking to be like in any pain or anything like that. Her posture is erect. Her stated age, how old are you?
15.
She looks to be like she is 15 years old. In her nutritional status, she does not look overweight. She does not look underweight. She looks appropriate for her gender, her age, her height, and her weight. And next I'm going to move on to vital signs, and I would do your blood pressure, your pulse, your respirations, temperature, and then I'm going to get your height and weight. I would normally do that in a doctor's office, but since we don't have the means to do that here, can you tell me how much you weigh?
125 pounds.
Can you tell me how tall you are?
5 foot 3 inches.
Okay, so in order to get her BMI, you'd use a BMI chart, but most BMI charts don't have, or most BMI charts are posted in doctor's office, and I don't have one, so I just use the one on my phone, and it says that her BMI is 23, which is normal. So next I'm going to move on to the head and face. For your head, I'm feeling for the contour of your skull to see if there's any bumps, lesions, any abnormalities in that. And I'm also, while I'm doing this, palpating your hair and your scalp to see if there's any lesions in that. I'm next going to move on and look at your overall facial symmetry. So your face looks to be symmetric. It doesn't look like there's any drooping, any shifts. Your eyes are the way they're supposed to be. They're not too far apart or too close together. Your ears are level. Your mouth is level. And you don't appear to have any drooping anywhere. So then I'm also going to feel her TMJ, which is her right here. And can you open and close? Alright, and so it doesn't appear to be locked or anything like that. If it was, it would click, and it didn't click. So next I'm going to be doing her maxillary and frontal sinuses, which are, her frontal is right up here, and I'm going to just palpate like this using my thumbs. And then her maxillary is right here, and I'm going to palpate using here. Okay, and she looks fine. And next I'm going to be doing her central nervous system. I'm going to be doing her her nerves 5 and 7, which are to test your facial nerves. So can you smile for me? Can you frown for me? And can you puff up your cheeks? So, and then I'm going to palpate her lymph nodes, which I'm going to start with her preocular, which are right here, to see if there's any inflammation. There doesn't appear to be any inflammation here. Then I'm going to move into her tonsil and her submandibular, and then her submental. Then I'm going to work my way and go down the cervical chain right here. There's lymph nodes behind and in front. And then I'm going to do her occipital, which is back here on the back of her skull, right at her hairline, and I'm going to palpate those. They don't appear to be inflamed. Sometimes you can feel a lump or a bump if it is inflamed, and hers aren't apparent, so that usually means that they're good. So next I'm going to be doing her eyes. So I'm going to be looking at her pupils, and the way I'm going to test that is I'm going to use this flashlight. Usually you could use an otoscope, you could use a pen light, you could use anything, but I don't have any of those, so I'm going to use my phone. And what I'm going to do is I'm going to put my hand as a divider, and I'm just going to sweep in and see if her pupils dilate on both sides, and they do. I'm going to test the other way. Alright, and they do, so they are reactive and they're accommodating to the light. Her pupils appear round, they're not football shaped, and they are probably about a size 5, and they're equal. So then I'm going to look at her conjunctiva, which is the white part of her eye, and it doesn't appear to be inflamed or yellow or anything like that. It is clear and normal. So then I'm going to do, to test her some more nerves in her face, is I'm going to look. I'm gonna have her follow my finger. So follow my finger away and close. And then I'm gonna do this. Just following your eyes. Okay, so she appears to be good there. And then I'm going to assess her ears. I'm going to be looking at the placement, which should be right even right here with her hairline, kind of. And so they are. And then I'm going to palpate her pinna, which is this part of her ear. And it doesn't appear to be overly floppy, or if it appears to have cartilage in it. Then I'm going to palpate her tragus, which is right here, to make sure that it's intact and everything like that, which it is. Then I'm going to get my otoscope, which I don't have one, so I'm going to use the pencil as a demonstration. And if you had it coming, this will be the tip, and this is the end. So you had it, you come out of the wall with it, and then you do this. You hold it like this, and you put, you hold it like this, and you put your pinky right here, and you would pull back and look in. So here you'd be looking for your tympanic membrane. Make sure that it's pearly white and no bulging of the tympanic membrane. And then you would do the same over here. And it appears to all be good. So then I'm going to be looking at her mouth. And I'm going to be looking at her teeth. Can you smile for me? Her teeth appear appropriate. They're not yellow. She doesn't look like a smoker. I'm going to have you open your mouth for me. And I'm going to depress your tongue with this. And can you say ah for me? Ah. And her uvula is midline, and it is not distended, and it is intact. And I would do a gag reflex here, but I'm not going to gag her for the video purposes. I'm also going to look inside. Can you say ah again? At her oral mucosa, which looks to be normal. It's not, there's not too much or too little. I'm also going to look at her nose. I'm going to be checking for her to see that it's midline in her face, and it is. And I'm going to look up with the flashlight and look in her nostrils. And I'm looking for any obstructions or abnormalities, which there isn't. And can you breathe like that? Can you breathe like that? So they're both patent, and her septum is midline and not deviated. Next, I'm going to be looking at her neck. If you could just kind of sit back for me. I'm looking at her jugular veins, which are right here and right here. I'm also going to palpate her carotid arteries. You can't see them, well, you can actually kind of see them if you're close right here, but you shouldn't be able to see them too much. And then you're going to move like this, and I'm just going to palpate the carotid artery to make sure that it is good. And I'm also going to listen for a bruit, which would be an abnormality. And there is none, and I'm going to palpate this side. And then I'm going to listen. Can you breathe in and hold your breath? Alright. I'm also going to be palpating her trachea, which is to see if it's deviated, and it's not. It appears midline. And I'm going to test the strength of her face and the range of motion of her neck. So if you can push against my hand, turn. And push the other way against my hand, turn. Alright. And next I'm going to be assessing her upper extremities. First I'm going to start with her shoulders at the top. I'm going to place my hands on her shoulders and see if she can shrug them with resistance. Alright, and she can, and they do appear symmetric. I'm also going to be feeling for the temperature of her skin, and I'm going to use the back of my hand. So her skin appears warm, dry, and intact. I'm going to be looking at her nails, which she has acrylic nails, but I can also assess, you would be able to see if they were yellow or clubbing underneath that. And her capillary refill is within 2 seconds. I'm also going to be looking at her turgor, which is to test for hydration, and I'm just going to pinch up the skin, and it goes right back, so she's not dehydrated. I'm also going to be feeling her radial pulses. so it's right here, and I'm going to be looking at the symmetry of her radial pulses. So I'm going to be doing this, making sure they're equal, and they are. And I'm going to just kind of feel down, make sure that everything is symmetric. I'm also going to be looking at her range of motion. Can you move your hands like this, and then up, and down, and then can you point your hands like this, like this, like this, and like this? Can you grip my fingers? And can you pull me towards you and push me away? Alrighty. And I'm also going to be looking at this time for any lesions on the skin or any abnormalities. And she has freckles, but that's a normal part of her skin for her ethnicity. So next I'm going to be looking at her heart. I'm going to be assessing the sounds. I'm going to be listening for bruits, wheezing, or not wheezing, sorry. I'm going to be looking for murmurs. I'm going to listen for S1 and S2 together and separately. And then I'm also going to be looking for extra heart sounds. And I'm going to do it in the 5 sites. So the first one is the aortic, which is right here. And then I'm going to do pulmonic, which is right here. And then I'm going to do the Erb's point, which is right here. And then I'm going to do the tricuspid, which is right here. And then the mitral or the apical which is right here. Okay, I didn't hear any extra sounds or any murmurs on her heartbeat. So next I'm going to be doing the lungs. I'm going to have you turn to the side so that I can assess the symmetry of your breathing. So she's going to breathe in, and I'm just going to watch my hands and make sure that they go. Breathe in, breathe out. Alright, so they are symmetric. She has symmetric expansion. I'm going to go ahead and listen while I'm back here for her anterior lungs. And there's 18 spots on here, and I'm going to be listening for crackles, wheezes, rails, or any other adventitious breath sounds. So can you breathe in for me? Breathe out. Breathe in. Breathe out. And then we're just going to use the stair-step method. Breathe in. Breathe out. 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 And breathe in. Breathe out. Breathe in. Breathe out. Breathe in. Breathe out. Alrighty. All of her locations were clear. I'm also going to be looking at her anterior place, or her anterior places. Can you sit back in your chair for me? And I'm going to be listening to the 10 spots on her posterior, or her anterior, I'm sorry. Can you breathe in for me? Just take a deep breath each location. Alright, so all her anterior areas were clear. I'm going to have you lift your arm to the side, and I'm going to listen to the upper and lower lobe on the left side. Then I'm also going to listen to the upper, and this side has a middle because it doesn't have the heart. And then the lower. Alrighty. Now I'm going to look at her abdomen, so I'm going to have you step up for me. And I'm going to have you just lay back on the couch. Okay. In the abdomen part, I'm going to be looking at the contour of her stomach, which her stomach is flat. It is not, she's not overweight, so it's not going to be overly round. I'm also going to be looking for any pulsations, and I don't see any pulsations, so there's no abnormalities there. And now I'm going to listen for any abnormal bowel sounds, and I'm going to start in this quadrant right here. I would say her bowel sounds are active. They are present. If you didn't hear anything, you would listen for 5 minutes, and because it is common to not have any if you've had abdominal surgery, and it would have after for a few hours just not have any. So then I'm going to palpate, and I'm just going to lightly palpate, and you just let me know if you have any tenderness, okay?
Okay.
And that's just the light palpation. And then I'm going to just kind of go deeper and just feel. Make sure there's no distension in her bladder or anything like that. So you're good, so I'm going to have you come back over here. That's it. So now I'm going to be looking at her lower extremities. So I'm going to be looking at her legs down. So I'm going to assess the hair on her legs, which is appropriate for her gender. They look to be even. Her heels are not overly cracked or dry. I'm going to have you sit on the edge of your chair. I'm feeling the temperature.
It's okay, keep going.
I'm feeling the temperature of her legs with the back of my hand, and her skin feels warm, dry, and intact. I'm also looking for her muscle strength. So can you push against me? All right, push against me. And that appears good. I'm also looking for her capillary refill in her toes. So I'm looking, I'm going to hold your foot up a little bit. And I'm just pinching her toes. Looking for a capillary refill. And her capillary refill is less than 2 seconds, so it's normal. And then I'm going to feel for her dorsalis pedis pulse. And I'm feeling right here. So can you actually sit back and put your leg up on your chair? Like put your foot up on it? Yeah. So I'm going to feel right here for her dorsalis pedis, and I'm going to do it on both legs. Make sure that both legs are getting full circulation. And hers are right here, and they are even and symmetric. Then I'm going to feel her posterior tibial ones. And those are symmetric as well. And then I'm going to have you stand up. I'm going to assess her hips for symmetry. And so I'm going to look right here and feel her hip bones. And so her hip bones are even. They appear to be even. And so you could do a range of motion to make sure that they are even, but we're just going to do a range of motion in her feet. So if you want to sit down for me, and if you can just do your knee out like this, knee and back like this, out like this, back like this, and then can you plantar flex your foot, and then dorsiflex. And this foot, plantar and dorsa. Alrighty, I'm also looking for any edema or swelling while I'm doing this. In hers, she didn't appear to have any. And then I'm looking at her feet to make sure they are symmetric. So, and everything looks good. So now I'm going to move on, and I'm going to do neuro. So I'm going to be looking to see if she can you do this on your legs? This is the rapid motion test. I'm also looking at her spine. Can you sit forward for me and turn to the side? And I'm feeling her spine to make sure there's no curve in it. And it appears normal. And then can you just walk forward for me? And her gait there appears to be no issues with her gait. So she's good there. And so lastly is her overall skin appearance, which there appears to be no lesions or anything on her skin. She does have a little bit of poison ivy right here, but other than that, she looks to be good. Other than that, everything looks good, and that's her head-to-toe assessment.